anticipate that yes, it will progress. And so if you've got that problem, I would have it. I have mine check every 6 months to a year.
I have another question. What about you having your ears cleaned? They always say you should use you should do it yourself, but my ENT charges every 3 years if he wants to clean them. I don't want to mess around with cleaning my ears, you know? I mean, it seems to me as though it's a very delicate mechanism and I don't want to do damage.
Some people, some people are susceptible to accumulations of earwax.
Right.
Excess. And, that's an individual thing. Some people have to have it done pretty often. No, I wouldn't do it myself either. You can damage it yourself.
Exactly.
Yes, some people don't. It's not a problem if they have the audiologist will typically look at your outer and middle ear before they do any of the testing that Lon was describing. And if there's a buildup of wax, they'll immediately know. But I said for some people it's a problem. You have to have it done often. For some people it's not.
My ENT said that Medicare only covers it every 3 years.
Well, it's also if the otolaryngologist identifies a problem, they can ask you to come back for general. But audiologists, I've never heard of an audiologist asking anybody to come back. That's a very personal thing. You can tell when your hearing is beginning to deteriorate to the point.
I'm not talking about that. I'm talking about the frequency of having your ears cleaned by a professional. But what I'm asking is, is it covered by Medicare? Is there some kind of limitation?
No, that would not be. I mean, you'd have the difference between, at this point in time, the difference between going in for anything to do with the hearing aid or improved hearing, as opposed to going in for a cochlear implant, is one of cost as much as anything else. Cochlear implant requires surgery and can be covered.
Harold, I'm talking about something very, very primitive. Having your ears cleaned.
Right. But what I'm saying, having your ears cleaned is a non-surgical operation, and it's very unlikely, in my guess, to get any sort of compensation for that unless you have specific insurance that covers it based on a medical need.
Okay, thank you.
Mark, do you have one more question?
Yeah.
We probably have time for a couple more questions.
Okay. First, I'm very glad that you're going to make the PowerPoint available. Is there, if one wanted to go into this, is there kind of a hearing aids for idiots book or something that you would recommend that's kind of good for those of us if we want to make, because it's a pretty expensive next decision. I have hearing aids and I want to know if I have to, I probably want to get better, more technologically sophisticated ones. Is there a book, simple book?
There are a couple of buying guides.
Uh-huh.
And if you want, I can make them, I can send, I make them available to Morris and or however you.
Marvelous. Thank you.
No, there are a couple of buying guides, which I think are probably useful. Yes.
Thank you. Thank you very much.
Any last questions or thoughts? But I just want to definitely want to thank you guys for taking the time to speak with us.
CB has a hand up.
CB has a question.
Oops. Okay, CB.
Yeah, just very briefly. You see hearing aids ever looking like these iPod things that people have in their ears and it's socially acceptable?
The only thing I can tell you is, for one thing, the fact that people are putting pods in their ears now has reduced the stigma for those of us who wear hearing aids. Because it used to be you stick something in your ear and they think you're ancient, or they think you've got a serious problem, they don't want to deal with it. Now everybody has something in their ears. And that's a good thing for us, who have hearing issues.
Yeah.
No longer look like a freak because I have something in my ears. But the technology is of the earbuds that the people are using now is actually fairly similar to the kinds of Bluetooth devices that some of us use. So yeah, it's a good thing. I think that it's reducing the stigma.
One other thing, it's really speculative and it's not a reality now, nor will it be in the next couple of years. If you want hearing, which is normal, it'll take medical not medical technology, but medical procedures. And we are nowhere near being able to do that. Although I must say there's a tremendous amount of medical research being done and continuous progress.
Yeah. We have discovered that there are some species of birds and fishes that do regenerate hearing, the hair cell. We don't, humans don't, but there is a lot of research, there is research going on trying to figure out how it's done. And I eventually, probably it will be done, but it isn't, I'm not holding my breath to see it. Of course, I'm old. So.
This has been very informative. Thank you so much.
It's a pleasure.
Yes, thank you. Thank you both.
Thank you very much.
Thank you.
Yes.
Thank you.
Thank you.
Thank you very much. Appreciate it.
And we heard you well.
We may not be able to hear, but you can always listen to us.
Bye.